I'm going to talk about the Health Workforce Scholarship Program. I joined the RDN team in the end of October last year and have been working on this program since then. Our team consists of 2 of us in the team, so there's 2 of us working full-time, but there's the broader RDN team that work on this program every single time they talk to a health professional out and about. Can I just get a show of hands from anyone who has not heard about the HWSP program? Okay, that's okay, but you will know about it by the end of this presentation. Anyone who has heard about the program but not accessed it? Okay, and people who have accessed it? Yay! Talk to the others, tell them how great it is. Okay. So a little overview about the program. It's funding offering scholarships and bursaries to primary healthcare professionals to undertake further study or participate in professional development. It's an initiative of the Australian Government Department of Health Workforce Program delivered by the rural workforce agencies across Australia, and RDN is the New South Wales deliverer of that program. It's intended to improve access to health services needed in remote and rural Australia by supporting an increase in skills, capacity and scope of practice. The scholarships and bursaries are available for health professionals, practitioners working in primary health care and Aboriginal controlled health services, non-government organisations and private practice. Health professionals who hold a primary professional qualification and working in an existing primary care role in medicine, nursing, midwifery, allied health, dentistry and Aboriginal and Torres Strait Islander health workers or practitioners must be providing or intend to provide services in M 3 to 7. Those employed solely by Health or New South Wales Government are not eligible. However, if you do deliver services in private care, whether it's 6 hours a fortnight, 1 day a month, you can still apply to the HWSP. We do have priority areas as identified by our Health Workforce Needs Assessment. So they consider Aboriginal Torres Strait Islander primary health, aged care and associated conditions, children and young people, chronic disease management and prevention as well, culturally safe practices and practitioners, end of life and palliative care, improved patient literacy and self-management, mental health management and team care and coordinated patient care. So what is available? We've got a scholarship payment of up to $10,000 per year over 2 years and a bursary payment of up to $10,000 per financial year over 2 years as well. So for a grad cert, we will consider $5,000 towards that education, a grad diploma, $8,000 and a master's or a PhD, $10,000. Bursaries up to $10,000 to contribute to the training or courses, and it does include travel and accommodation as reasonable expenses. So just a quick overview of some data on where the HWSP has allocated some funding since the inception in 2017. Now these are only applications that have been paid to date, so not including any that are sitting there waiting to be paid, waiting to be assessed, waiting to be approved for payment. There's probably a 50% again sitting there that are ready to go. So I won't read them out, I'll just leave that slide there for you to have a quick look at. We can see that physios and OTs are the movers and shakers in our allied health space. And this is a quick snapshot, it's probably a little bit hard to see, of where those scholarships have been allocated across our state. So quite spread out, which is really nice, meeting the needs of the communities. So now I'm going to share with you a couple of good news stories that our comms team have managed to capture. The first one, the quality of the video is not so good, so the comms team send their apologies, but it's a great story.
Yeah, hi. My name's Mick. I'm a caseworker here at the Moree Aboriginal Residential Rehabilitation Service in northwest New South Wales. I found out about 18 months ago through a friend that the Rural Doctors Network were offering bursaries through the Health Workforce Scholarship Program. I enrolled in a diploma in alcohol and other drugs. My application was successful and I was granted the full bursary to complete this course, which I finished about 6 months ago. I've since enrolled in a diploma in mental health, which again, I put in a application and it was granted. So the financial help that I was able to gain made it a lot easier for me to do my studies. As I work in a rehab, the education is priceless because I know when I was going through addiction, without trained people to help me, it would have made it very difficult for me to get well. So a big shout out to the Rural Doctors Network, enabling me to, I've almost completed my second diploma, so enabling me to study, with no financial pressure has been really helpful. And now I'm able to continue using my study to further help people here at the rehab and to make a difference in my community. So a big shout out to the Rural Doctors Network. It's a great program and I'm fully appreciative. Thank you.
And one more.
Hi there, I'm Deb Hopper, an occupational therapist. I work mainly in paediatrics, but I do some adults as well. And I'm based on the mid north coast of New South Wales. And I just wanted to share how fantastic the Health Workforce Scholarship Program has been for my continued education the last 15 months. I've applied for numerous bursaries and been successful, and I've attended a number of these away from home, interstate, and also a couple of online workshops. So I have attended a leadership and occupational therapy workshop, conquering the wheeze and poos, helping kids with toileting issues, helping kids with rest and sleep, Smarty Pilates, and my cognitive behavioural training were completed online, which was nice to be able to stay home for that. And I've also attended the Zones of Regulation training in Sydney, and also some social thinking workshops in Melbourne. So if you're thinking about applying for these scholarships, please do, because it is life-changing. It has helped my professional confidence. I am supervising more and more occupational therapists around Australia, which is fantastic. And I'm also being asked to speak in my workshops nationally, which is really fantastic, on sensory processing and helping kids with anxiety. So yes, please, apply, and thank you so much for this funding. It is just really, really awesome. Thanks. Bye.
Okay, has anyone got any questions about HWSP? No? You're going to go home and put in an application? I will be here this afternoon and this evening, and we'll be here tomorrow as well. So if you'd like to come and chat to me, anything to do with the processes, applying, what's available, I'm happy to have the conversation. Thank you.
Tracy,
Oh.
how long is the process? So when you apply to when you hear back?
Thanks, Annabelle.
When you apply, if you've been to a course, last weekend, could you apply on Monday?
Yep. Okay, retrospective costs are not included in the program. That short window time frame, we could maybe have a conversation, but generally it's not considered under the program. The time frame varies on the number of applications. So when I started in October, we left leading up to Christmas with about 35 applications submitted, ready to be assessed. I was stressing about that because I wanted to clear it down to 0. About 2.5 months ago, we were sitting at 200 waiting to be submitted. So word got out, people were talking, people were reapplying, which is really great. So our time frame pushed out to about 6 to 8 weeks. So we put a bounce back on our emails, just advising people of that. As I said, there's only 2 of us in the program, so there's a lot of work that goes behind an application, regardless of whether it's for $100 or for $10,000. It's the same process. So at the moment, we've got that down to about 100 sitting in the submitted when I left on yesterday. What day is it? So hopefully now it's about a 4 to 6 week process. And one of the tips is upload all the documentation that's requested in each of the emails that you get, and that won't slow down the process. Chasing up if you haven't done your receipt, etc., that does slow it down. Travel and accommodation is at the ATO rates, so you don't need receipts for that. We just pay based on ATO rates. Oh, yes.
I saw the list of the types of qualifications that the scholarship funds. I was just wondering, is it like bachelor degrees? Are they not included in the scholarship?
Not undergrad degrees, no.
Because I was just the thought of that was that I know that a lot of master programs are within the universities, especially with speech pathology and audiology. They're in the localised universities in these areas, but like with the Bachelor of Speech Pathology and stuff like that, they're available in more of the universities out closer to rural and remote areas. So I was just thinking, could that be that gap kind of, Yeah.
I hear what you're saying.
Yeah.
Unfortunately, we're governed by the Commonwealth guidelines.
Fair enough.
We've got our first operational group meeting next week, and these are sort of questions that we can take back to the group to be raised at a national level. So whatever, at the end of the day, the program's out there to meet the needs of the community, and that's based around service and availability of trained staff as well. So by all means, that feedback will be fed back through. I see lots of notes going down there.
Hi, just wondering, with that amount of applications, is it even worth bothering to submit one? I mean, what's your limit here?
Well, I can't answer that and what the limit is. When you submit your application, you have to write. There's 2 questions you need to answer, and one is around how will you meet the needs of the community by doing the course or the education that you want to, and how will it add value to the service that you deliver. So essentially, if they meet the needs of our health workforce needs assessment and the gaps in what the community need, it will be approved at this stage.
Sorry. So many questions.
Just to clarify, can an outreach provider who lives in an urban area but provides regular outreach to an MM3 or beyond, they're eligible?
Yes.
Great, okay.
If there was an application that came in for a conference or something similar, would it be given consideration if it was on a time frame, to meet the commencement of that course, the application?
So are you saying that you wouldn't book or pay for that course if you weren't guaranteed?
Yeah, I was asking that exact same question.
Yeah, okay.
So, because otherwise then you, with the assumption that it would be funded, would then have to meet that cost even if you weren't capable. Yeah.
Sure. As I said, at the moment, we're looking at a 4 to 6 week turnaround time. I'm happy to take a call to get me to give a quick glance at the application. I can't prioritise. They're processed in the order that they come in, but definitely happy to have that phone conversation via phone or email. Yeah.
Thanks, Tracy. It's Richard. I don't have a question. I just want to say congratulations to you. I think that's one of the best pitches I've ever heard for admin support. And it's very hard to sit here and say we can't afford any more admin. So I don't think you need to worry about the timelines anymore. We'll be able to sort out that admin support you've been asking for.
Well,
So
thank
well done,
you.
Trace. Good job.